Hello everyone and welcome to my channel. In today's video I'll be talking about breast self-examination. I believe you must have heard it before. Breast self-examination. What is breast self-examination? It's a way an individual check her breast in order to feel if there's any abnormality or changes, and then that will allow you to go to the hospital and see a medical professional. So how do we carry out this breast self-examination? It's something you can do, and it's important you do it every month, and you don't do it when you're menstruating. When you're seeing your menses, you have to do it at least 7 to 14 days after your menses. Why did I say that? It's because during your menstruation we tend to have hormonal changes. You have some people feel pain in their breast while they are menstruating. Some people feel some abnormal changes in their breast while menstruating. And if you go ahead to do the breast self-examination while menstruating, it will give you a wrong result. You'll be thinking, oh, I've got this abnormality, but it's actually normal because of the hormonal changes you're experiencing at that moment. And if you're not menstruating again, if you've gone into menopause, that's very fine. You can choose a particular date of the month and do it. It's good to do it regularly so that when the change is in, you discover it immediately and move straight to the hospital. Remember, it's easier to treat a disease when it is early detected. That's why it's good to start doing this breast self-examination every month so that when you see any slight change, you move straight to the hospital to report to your medical professional. Okay, the first one is just to visually inspect the breast, and then the second one is manually examine it by feeling it. Okay, during the visual inspection, what is expected of you? What you have to do is just to stand in front of a mirror, place your two hands on your waist, look directly on your breast puckering, if there's any dimpling, if there's any redness on the breast, if there's any abnormal rash that has not been there before. The next thing you have to do is to check the size of the breast. This is very important, of your breast, and it will help you to know when it has started enlarging, when it has started getting bigger than it used to be. Just inspect your nipple, look at it. Is there any retraction of the nipple? Is there any abnormal changing as the nipple size? Those are worthy of notes. Okay, then the next thing you will want to do is to go and feel your breast. Yes, it is your breast. It's good to feel your breast once every month to see if there are changes. Now, how is this done? You will have to lie on your bed or on a couch and choose which of the breast you will want to examine. If it's the left breast you want to start with, that's fine. If you want to start with the right, that is also fine. So what you have to do is that while examining the left breast, you place a pillow underneath your shoulder, your left shoulder now, and use the pad of your 3 middle fingers, and then apply a pressure in a systematic way. Apply a pressure. Start feeling your breast in a circular motion from the top part even onto the under, and also check the armpit area. While doing this, you check if there's any lump, check for any thickness, check for any mass, and check for any pain, unusual pain in any part of the breast while applying that firm pressure. Okay, this will also help you to know if there are changes you need to report to a healthcare practitioner. I hope this video has helped you to understand how to do your breast self-examination. If you have decided to start checking your breast, kindly comment on the section below, and see you in my next video. Thank you and bye.